Hello and welcome to Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. This is part 2 of a 2-part series with none other than Tasmanian Jon K. Jenny is not only a psychotherapist, she's also, an educator and a heck of a researcher too. She comes with a diverse background, and in our first part, we discussed gender affirming care. And there's still so much more to cover. We thought one part wasn't going to be enough, so we jumped in with a second part. Jon Uhler is here today with us as well. Jon, it's always great to have you on the show. So much to talk about. You and Jenny last time spoke about, everything that needs to be discussed with gender affirming care, but we delve into each topic so deep that it requires more time and more effort to get into the real nitty-gritty of what this is all about. So where does today's show head, and what's about to come up, Jon?
Brad, thank you as always. And we sort of left part 1 cliffhanger at a point. We have Jon K, a genuine professional. She is a registered nurse. She's been a psychotherapist for years. She has been working with one of the most challenging of populations as far as mental health, which are eating disorders, and that is so pertinent and applicable to the trans movement, because really that comprises a population of kids that are very wounded, significant mental health issues. There's about 9 key red flag clinical indicators. Oftentimes it's trauma related, very often it's sexual abuse, and also a significant percentage of those kids that are being recruited into the cult-like aspect of the trans movement. Jon K helped us understand and see the relationship. We talked about the relationship between cults and the trans movement as far as recruitment and retention. And she was beginning to introduce, with her registered nurse background, the health effects of the application of puberty blockers, and we're going to pick up where we left off. Jenny, thank you so much for being here, because you're going to you're going to pick up where we left off. This is a moving sidewalk as far as the trans movement. If a kid gets recruited, if a kid gets emotionally and mentally manipulated into this movement, parents need to understand it's heading somewhere, and there's very predictable stages. It starts with the social transitioning. If they want to go back and find out what that is, you laid that out beautifully. Then it's going to transition to the next stage, which is the medicalization. And the first stage of that are puberty blockers, because that starts young. Jenny, continue with your list. I encourage people to go back and listen to part 1, because you started to list off medical facts and details about the dangers of puberty blockers. So pick it up at that point.
Sure. So I've got a list of the complications and side effects. Some of these are due to hormones, some are due to puberty blockers, and some are due to surgery. But to start with testosterone in girls, you're going to get gross clitoral enlargement. So the clitoris starts to enlarge. In some cases, it ends up extending beyond the labia, the lips of the vagina, and then rubs against the jeans the girl is wearing and will start bleeding, so that it becomes like a micro penis. And it becomes painful and abnormal looking. So then also another side effect of testosterone is that the girl, when she does have sex, if she does, can have terrible pain in her uterus on orgasm. And that's a horrendous side effect. We've also got body hair. Suddenly the girl's going to have body hair. And these are permanent changes. You're going to have permanent facial hair. You're going to have baldness in a girl. Now, how can this be good for someone with poor self-esteem, who's a self-harmer, which most of these girls have got those sort of issues? You're going to have loss of breasts if you have a mastectomy, and a lot of girls are having them as early as 12 or 13. You're going to have loss of normal sex genitalia. Your normal genitals are going to be damaged permanently in many cases by testosterone and then by surgery, and you're exchanging them for non-functional genitals created by surgeons. And if you see any of the pictures of these kind of surgeries or the results, they're absolutely horrific. People can't even stand to look at them. They're so appalling. Then you've got the need for a colostomy bag. Now, what effect is that going to have on a kid? Because often, because of other side effects, kids can end up with incontinence, or young adults end up with incontinence. Because when you start messing around with the whole urinary system and the genitals, things go awry, not surprisingly. So you can end up with incontinence of both urine and feces, and you can end up with fistulas. I don't know if you know what a fistula is, but it's a communicating channel between the urethra or the vagina and the rectum. So poo can come out of the vagina. These are bad.
Let me stop. Hold on. Ready? I've been in the field while I'm talking about brats, right? Okay. This is why we're doing this.
Yeah.
Right? Because we're going to talk about affirmative care, affirmation care, and what politicians are doing. They're outlawing regular therapy. Okay. What isn't being talked about is one of the primary concepts in the world of mental health, any kind of treatment, is informed consent, right? To be able to make fully informed consent, that's a legal term.
Yeah.
You need to be able to adequately say yes, even as an adult, right? Whether you see it in pharmaceutical commercials, remember all the side effects might be, well, up they come. And you don't know if the cure is worse than the disease or vice versa. Okay.
Yep.
So they are required, health professionals, mental health professionals, we are required to give somebody enough information with which to make an informed decision. And that also means this, that they can comprehend it, that it sinks in. Exactly. Okay. So we're talking about kids. We're talking about minors. We don't give a firearm to a little kid, or, we don't let them smoke, right? Because kids may think it's cool. If a kid on the playground is, walking a kid through a park and he finds a cigarette butt, what, you're going to let your kid just put it in your mouth? We go, no, buddy. And now we've got to start to explain, oh, here's tobacco. These are the effects. Well, we know a kid can't comprehend. A kid is influenced by peer culture. Okay. So the reason I felt compelled to interrupt is I really want parents to understand. And you know what, parents, let your young people listen to this. Sit them down, right? Because they're being unduly influenced. Oh, it's no big deal. You're just going to go through top surgery. Really? Okay, no. They need to know all the potential complications. And Jenny, as you're describing this, the colostomy bag, hello, that'll stop the trans movement right there. Okay, so pick that back up about what potentially happens, because part of the surgery, especially for boys, but also for girls, because they're going to make false or fake penises. We haven't even gotten to that. You're going to talk about skin grafts. But okay, so we're talking that if a child is permitted, if a minor is permitted to get on this moving sidewalk and undergo some of these surgeries. So tell us again, there's the chance of a colostomy bag?
Absolutely. There's a chance of a colostomy bag, and there's a chance of permanent urinary incontinence. There's a chance of ongoing urinary tract infections. So, for instance, Scott Nugent, who had surgery as an adult woman to become a man, he has chronic urinary infections, and he said I should say, because she recognizes that she's a woman, she's going to die from those urinary tract infections eventually. They're going to kill her. So if you have a phalloplasty, that means creating a false penis in a woman. They take flesh from the arm or from the thigh, and they sort of turn it into
a big skin graft. They take a skin graft.
Massive skin graft. So you end up with a flayed arm that looks abnormal. And sometimes people get neurological problems in their arm. They can't use their arm properly anymore. And it also looks really, really, really abnormal. And they turn it into a sort of sausage and try to create a urethra, the weeing tube, in the middle of that, and then attach it to the woman's pelvis to look like a penis.
Jenny, what term? Okay, so for women, for young girls, for females, for teen girls, they're going to be encouraged. So first they're going to go through puberty blockers and cross-sex hormones. And now these surgeries, and in order, we got top surgery and bottom surgery. Parents are hearing these terms. So it's typically going to be top surgery first and bottom surgery. So using the correct medical terminology, tell parents, so first it's going to be top surgery. So tell them what that is, and then bottom surgery.
Okay, so top surgery is having your breasts removed, and girls as young as 12 are doing that. And that has a lot of side effects too, because these girls don't realize later on they might want children and they might want to breastfeed. And it's heartbreaking for them when they realize, I do want to have a baby and I can't breastfeed my baby. I don't have breasts anymore. They don't realize that because they're too young to make that decision when they do make the decision.
So now, top surgery is a double
mastectomy. Double mastectomy, And bottom surgery, which actually only about 13% of girls sign up for bottom surgery, thank goodness. But that is the creation of a false penis. It looks like something Dr. Frankenstein would come up with, and it has something like a 67% complication rate. And some of those complications include gangrene in this pretend penis and the penis falling off. And almost always the penis is not functional. So it's an horrific surgery that no one should be having. No one should be having, because the complications of fistula, meaning that communicating channel between your rectum and your new urethra, is very, very serious. Sepsis, meaning septicemia, blood poisoning in your whole body, that has a very high fatality rate, septicemia. And dysfunction of the organ becoming gangrenous, like I said. And it just has a phenomenally bad effect. Blood clots are another side effect. So Scott Nugent, who had this phalloplasty surgery as an adult woman, ended up with terrible blood clots and terrible septicemia, or total blood poisoning with infection, which led him to have a heart attack he nearly died from. And he currently has, it takes him 10 minutes to go to the toilet. He says there'll be urine everywhere because those parts of the body have been so damaged by this insane surgery that he can no longer urinate in a normal way. Urine will end up everywhere. So all these side effects are just not explained or described when people get on the trans train.
I don't usually like to jump in, but I have to for a moment because I'm scratching my head dumbfounded. Part of this movement is to make people feel comfortable in their own bodies. Another movement is the sexual aspect of things. Another aspect is the mental health side of it. And there's so many different aspects. But let's talk just briefly, and I bring this up only because that doesn't sound like anybody's going to be having better sex at all.
Well, no, they're not, Brad. They're not going to be having any sex. This is the thing. You're taking functional, healthy genital organs and replacing them with these Frankenstein meat Lego organs that don't work properly. And that's for boys and girls, for men and women. Generally, they don't work well because medical science can't create functional sex organs. They can only create the appearance of opposite sex organs.
So I was going to say, I'm assuming now that AIDS is still a big part of this too going forward, and that's it was part of the gay lifestyle for so many years, and obviously that hasn't gone away. I think that, while they've got maybe a treatment to slow it down, I don't think that there's necessarily a treatment to make it better or go away, right? So
right.
What's going to happen there?
Well, something interesting. Someone on Twitter did a little table showing what sort of sex people can have after they've had gender transition. And mostly they can't have a lot of them can't have genital sex anymore because those organs have been damaged so much and their new organs don't function. So all that's really left to them is anal sex. And I really wonder if, because anal sex is being pushed on kids in schools nowadays, it all seems to tie together. That these kids can end up as sort of, I think of them as almost ending up like a kind of sex toy for pedophiles because they've been
Jenny, I could not concur more. That's why, again, Unmasking the Trans Movement is not anti-anything. We are pro the protection of children and women, vulnerable women and children. And what is behind this to a significant extent, you have financial predators, you have very darkened special interests, meaning with darkened motives, secondary gains. And so you have financial predators, which are the medical, you have big pharma, but you have sexual predators. And if you consign a child, a young person, then a teen, that all they're ever going to be able to do is be on the receiving end of potentially very deviant older individuals, that's what you consign them to for the rest of their lives. You will continue to traumatize them because the anus was not designed for penises.
Right. Exactly. And you've also got people who look like children to one degree or another because you've arrested their development. So, of course, that really appeals to pedophiles. A childlike body, often with no breasts, and for some boys, they're having penectomy and orchiectomy. That means their penis and testicles are being removed. So, that's like a dream come true for some sexually deviant older men.
Anything else about the physical?
Okay.
There's so much more, and we're going to beyond this program, we're going to have you back, and we're going to be able to methodically really expand on these concerns. But I'm envisioning beyond this, we've got the social, what happens to a child, what happens to this dating life, this social, we got the psychological, what happens. So keep talking.
Sure. So we see with testosterone.
Let's start at the beginning again, please. You can just start in with so. Go ahead in 3, 2, and 1.
So psychologically, we see a lot of harm from puberty blockers, cross-sex hormones, and surgery. We see an increase in self-harm behavior. We actually see an increase in suicidality. We see an increase in aggression. We see an increase in psychosis. We see an increase in agitation. And we see an increase in psychiatric diagnosis. So some of these girls end up in a psychiatric hospital because it is mostly girls. Like I said, 88% of treatment recipients are girls. And then they acquire all these diagnoses and they end up on a lot of psychiatric meds. And nobody says, oh, maybe it's the testosterone. So you've got that risk in itself. They end up with PTSD because you have traumatized them by mutilating their body. They end up often with disgust with their new body too. We have the case of Nathan Verhelst, a Belgian a woman who became transitioned to become a man and ended up choosing euthanasia because she was so horrified with her new body and her penis that didn't work, and she thought of herself as a monster. We have another one in Canada who's signed up for the MAID program, the medically assisted euthanasia program in Canada, because she's appalled at what she's done to herself. Well, sorry, Duchess Lois is a man who had transition surgery, and she's horrified. He's horrified. Sorry, it does get confusing, doesn't it?
Yeah, right.
He's horrified at what he's done to himself.
And Jenny, this is going to be, we're going to do another program on this, because this is the one of the dirty little secrets, that the push toward euthanasia, that you take kids, and how much more dangerous can this be, that if a child has been perped on, if a young teen has been perpetrated against, sexually offended against, very often they want to keep the name and the reality of the perpetration to themselves. So in a way, we can call this facet of it, where the kid kind of awakens also buyer's remorse. And now they were already depressed, they're already fragile, they're already vulnerable, and now why am I going to live? My contention is this is the ultimate of the silence of the lambs.
Yes.
And now it's state sanctioned, because now we're going to pay for euthanasia for these kids, and eventually physician assisted, and then pretty soon you're only going to need one physician's signature. It always goes in that direction.
So I can get both of you caught up in this right now. That's happening here in Canada already.
Yes, it's terrible. It's absolutely horrific what's happening. Yeah, it's like, well, we made a mistake with that one, so we'll let him or her kill themselves. It's sort of like an embodiment of the saying, doctors bury their mistakes.
And perpetrators can ensure silence.
Exactly. And there's lots of ways in which that's happening too, because a lot of unhappy transitioners don't want to come out and say this was a mistake, because then they will lose their community, their cult community. They'll have no friends, and they'll be called a transphobe and a TERF, and they'll be abused. And, they will be pushed to suicide too for daring to go against the cult belief system. So, socially and psychologically, there are so many bad effects, and not least of which is the betrayal of a child's right to be a child. Instead of a parent being the arbiter of reality, the parent is going, oh, well, if you believe you're a boy, you must be a boy. Now, that's very harmful to children, because suddenly there's no boundaries, there's no reality, there's only feelings. And that's a terrifying state for a child, to have the burden of figuring out what's real. No child should be put in that position. That's a parent's duty to be the arbiter of reality and to reflect, yes, your intuitions are right. That drag queen at Drag Queen Story Hour is a man. But you see, we're just systematically confusing and disorienting children and trying to dissociate them from biological reality through social media.
Our last 10 minutes, where do you want to take this, Jon? I think we've had 2 great sessions already, and we can kind of come to conclusion here with our last 10 minutes of this program and kind of wrap this one up. And there's so much more to discuss with Jenny in the future too, like you mentioned already.
We're going to have Jenny back. These are all, as it were, as they say in some industry, these are teasers, but we're not flippantly.
They do.
As you just referenced.
Jon, we're not flippantly what? Oh, froze again.
Hold on.
Okay, we
Brad,
froze again. We're going to do this not flippantly in 3, 2, and 1.
We don't say this flippantly, but we want people to understand there's a lot to unpack with each of this. You are just skimming the surface, Jenny, so we're so appreciative. But as you indicated, it's very scary for a child to sort of almost be in charge of. So the child is encouraged that if they feel a certain way, then they're encouraged to move in a certain way, and then the parents and good protective people are no longer protecting them. They have to stand back and affirm. Talk to parents, talk to good people, talk to grandparents about your concerns about affirmation therapy, and then what is coming from that as far as some of the laws. Talk to us about your concern. Describe what affirmation therapy is and your concerns about that.
Sure. So the term affirmation therapy to me is a contradiction in terms, because therapy is not about affirming people's beliefs. I mean, like Lisa Marciano, who's a very good Jungian therapist who's gender critical, says that, say, if she gets a male patient who says he's going to kill himself because his wife left him, we don't say, oh, yeah, that's right, you've got nothing to live for anymore. And we don't say, I'm going to ring your wife and tell her to come back to you. We don't affirm. We help explore. Therapy is about exploring and trying to come to the right conclusions and helping a person understand themselves. So the fact that therapists and doctors and others, even parents, are under pressure to affirm means we're all being forced to take part in this cult belief system, whether we believe in it or not. And we're all being forced to ignore the reality of all the harms being done by this whole belief system and by the whole process of gender transition. So it's really quite almost totalitarian to impose affirmation. And the fact that it's being imposed particularly on psychotherapists and clinicians means that, say, if I got a client, my doctor says I am a boy.
Say if I have a client in 3, 2, and 1.
So if I have a client who's a girl who has been persuaded through indoctrination that she's really a boy, and if I was to say to her, well, let's explore that. Why do you think you're a boy? What's happening in your life? What other issues are you having? If I'm just using exploratory psychotherapy techniques, I will be accused by trans activists of engaging in conversion therapy, because apparently my duty is just to put a rubber stamp on this belief system and send that person off for medical treatment. So it's very demoralizing and disrespectful to therapists. It's just saying we're just a rubber stamp. Your job is to send that person off so they can have medical treatment. So it's really disastrous.
And that also then leaves the client, the young person, the troubled teen, again, feeling additionally anxious because deep down inside, this child wants help. And if all they're told is, well, yeah, it sure sounds like, can you imagine? I'm depressed, feel like killing myself. Well, it sounds like you're depressed, want to kill yourself. So there's a bridge over there, right? Well, far be it from me to begin to help you. So this is the only issue in the whole wide world that a therapist can't do what a therapist normally does. So if somebody comes in saying, I have panic attacks, or I feel like killing myself, and you just reference that, every therapist is trained to help try to secure safety, right? To do no harm, and then to help get to the root. Where did this start? But isn't it interesting with this one facet that's the only thing we can never help a young person explore, despite the fact that there are 9 red flag clinical indicators that speak to that this young person has been sexually traumatized. And who benefits from that? The perpetrator. That's why it's a significant concern. It's a huge concern for those of us that care about young people, care about the safety, and we are mandated reporters. Jenny, if there is a parent out there, if there's a grandparent, in about 2 minutes left, the clock is not our friend at this point, but again, we're going to have you back. What would you
in 3, 2, and 1?
My advice to a parent.
What's your message?
Oh, sorry. My advice to a parent.
Start again. 3. You're going to say, what was that, John?
What is your message?
Question. Yep. 3,
what is
2, and 1.
Jenny, what is your message to parents or grandparents or extended family or good people with respect to this?
My advice would be to be loving and supportive and to accept the fact that your child has these belief systems, but to treat it as you would a child who had anorexia or a drug or alcohol problem, and maybe look into organizations like Al-Anon, which help you learn how to be supportive without going along with something that's extraordinarily harmful, and to be the basis of reality for your child. To make it clear, I do not believe in this and I will not enable it, but I do love you and care for you. My other advice would be to get as much information as you possibly can. Knowledge is power, and to unite, to find other parents. So parent groups could be very helpful, support groups. There's a lot of good websites as well, like GenSpect and Transgender Trend. So get the information. Don't believe what you're told. Be extremely skeptical. Remember that doctors and therapists are not really on your side in this situation.
Jenny, if anybody wants to reach out to you, they can certainly contact us at UnMaskingTheTransMovement.com. If they want to access any of your work, do you have a social media page?
Oh, yes. We have a Facebook page called Attentive Watchful Waiting. So if they look that up on Facebook, and it's also on Getter, but most of our activity is on Facebook. So Attentive Watchful Waiting with the A, W, and W capitalized, if I remember rightly. But any way you put it in, it'll probably come up.
Penny, thank you for being a wealth of knowledge and information. We're going to have you back, and we're going to unpack much more of this because your knowledge is something that people need to hear. So thank you so much for being a part of the program.
Well, thank you very much, John and Brad. I really appreciate the opportunity to be here. It's been a pleasure.
Thank you both for being on the show today. John, I know your time is limited. Always great to talk with you. And Jenny, I hope you enjoy your summer down under because we are freezing up here in Canada. Thanks for watching, everybody. This is Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wilder. I'll see you next time.